viewers and listeners. On today's COVID-19 update, Minister of Health Dr. Frank Anthony says Guyana records another record-breaking COVID-19 vaccination day yesterday. He is also urging persons to visit any one of the ministry's vaccination sites to take their jabs.
So the total numbers as of yesterday would be that for adults we have 359,222 persons who would have received the first dose of one of the COVID-19 vaccines. That really would put us now at 70% of our adult population who would receive at least one dose of the vaccine. We also have 199,978 persons who received a second dose, and so now we have 39% of our adult population who would have been fully vaccinated. Yesterday we had another record number of persons who came out to get vaccinated. So yesterday we were able to administer 9,510 doses. In terms of the Pfizer vaccine, we have administered 24,460 first doses and another 11,601 second doses.
On Sunday, the Ministry of Health will be hosting another COVID-19 vaccination drive-through at the National Cultural Center.
Well, all the vaccines we have, with the exception of AstraZeneca, where we are now only administering the second dose because we have given out all the first doses. Now, those persons who need their second dose for AstraZeneca, they can come and get that. In addition, for first dose now, we have Sinopharm, Sputnik V. We also have the J&J vaccine. For second dose, you have the Sputnik V, AstraZeneca, Sinopharm. J&J is a one-dose vaccine as of now. And for the children, we have Pfizer, both first and second doses.
Minister Anthony disclosed that Guyana will soon be able to access the Indian COVID Vaccine Intelligence Network.
We're in discussions with the Indian government. They want us to sign an MOU. We have agreed on signing that MOU, so we are now awaiting the appropriate date when the MOU can be signed. Once that is done, I suppose we'll then be able to access the app.
He also outlined the process to replace a COVID-19 vaccination card.
Well, if you misplace your card, you have to apply to the ministry to get a new one. And it will take some time because we'll have to go through the books and to make sure that you were vaccinated in the first place. Well, of course, that's a myth. The vaccines will take a small component, inactive component of the virus and present that to the immune system, and then the immune system would react by creating antibodies. So for the purpose of stimulating the immune system, you have an inactive piece of virus that would do so. And in this case, they'll use part of the spike protein. This piece that they're using would have no effect on triggering any neurological or any type of damage other than triggering the immune system to prepare antibodies. So if you're actually infected with COVID, then your body would be able to react quite quickly. Your immune system, there are two components to it. You have what is called an innate immunity, and you have adaptive immunity. If you're unvaccinated, then you'll have to start by going through the innate immunity, which is the body trying to determine what type of virus and come up with a reaction to it. That takes about 7 days. And during that 7 days, if you're infected with COVID, your immune system, if during this innate immunity period, you can really get sick because the virus can really multiply, and that's what we're seeing with some of the patients that are coming into the hospital. If, however, you are vaccinated, then your immune system would already be primed, and therefore your adaptive immunity kicks in, which would be able to recognize the virus very quickly and start the process of inactivating that virus. And that is why most people who are vaccinated would have a milder form of the disease and prevent them from getting into the hospital.
This has been today's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.